This is the first video in a series on hepatitis C and will be an introduction. Let's now discuss about transmission. That is, how can people get infected with hepatitis C? Blood or blood product transfusion given before 1992. Since then, blood and blood products are screened for hepatitis C before transfusion. The sharing of needles, syringes, and other equipment, particularly during the use of recreational drugs like heroin, is today the commonest source of transmission. Another cause of transmission is needle stick injuries in a healthcare setting, for example, among doctors and nurses. Then we have tattoo and body piercing in a non-regulated, unhygienic place. Other forms of transmission would include having unprotected sex with an infected person. But this is a rare source of transmission among monogamous couples. From mother to baby, if the mother has hepatitis C. About 6 in 100 babies born to hepatitis C mothers get infected. Sharing of razors, toothbrush and nail clippers is another rare means of transmission. It is important to note that there is no evidence that a person can get infected by kissing or hugging, sneezing, sharing food, water, cooking utensils, or drinking glasses or breastfeeding. Who should be tested for hepatitis C? As usually there are no symptoms, people who are considered to be in the high-risk group should be screened. These would include drug addicts with a history of sharing needles, example when injecting drugs. Use of intranasal drugs, example cocaine. Those with a history of needle stick injuries if skin is accidentally punctured by someone with hepatitis C, like healthcare workers. The chance of getting it if skin is punctured by a needle used by someone with hepatitis C is about 1 in 30. If someone has shared razors, toothbrush or nail clippers with infected persons. History of blood transfusion or transfusion of blood products before 1992. Those with tattoo and body piercing, particularly if it's done in an unregulated setting. Sexually active, promiscuous heterosexuals who had unprotected sex. Heterosexual partner who is infected, but the risk is very low with heterosexual couples. The risk is estimated at between 1 to 4%. Men who had sex with other men. Infants born to hepatitis C mothers. HIV patients, and those on kidney dialysis. In many countries, it is recommended that all those above the age of 18 be tested. Let's now talk about the stages of liver disease in hepatitis C. Most people with hepatitis C do not have noticeable symptoms. They appear healthy until the liver has been significantly damaged. This means that many people have the infection without realizing it. It can only be found for certain if a person has hepatitis C by having a blood test done. That's why I had discussed earlier who needs to be screened for hepatitis C, that is, those who are in the high-risk group. Once the liver is significantly damaged, the patient can experience some symptoms like tiredness, weight loss, stomach pain, nausea, itching, yellowness of skin and eyes called jaundice, When patients initially get infected by hepatitis C, it is called acute hepatitis. Only about a quarter of patients with acute hepatitis C feel unwell and sick, but the majority are not aware they have the infection. Unfortunately, in about 80% of patients, the virus persists beyond 6 months and they have now what is called chronic hepatitis C. A significant number of patients with chronic hepatitis C will develop scarring or fibrosis of the liver. About 1 in 3 patients go on to develop cirrhosis or hardening of the liver, which can go on to liver failure and liver cancer. It normally takes about 20 to 40 years to develop cirrhosis, liver failure and cancer. It is estimated that liver cancer develops in 2 to 4% per year in patients with cirrhosis. It is estimated that the risk of liver cancer is increased 20 times in patients with untreated chronic hepatitis C.